the very sweet chestnut blind stallion that's in quarantine, thankfully by himself. Dr. Gina did some diagnostics and he cultured multiple bacteria, one of which is a rarer one and has significant zoonotic potential. So that means that immunosuppressed persons could get this bacteria from him, and it's not great news in terms of what it can do. So just please be very aware. We always want to use good hygiene, but do not kiss, touch, rub your face on, and or handle things that horse has touched or eaten out of. You know, like we need to be washing our hands in between things. So just please be aware of that. We don't have the full information on that case yet, but we're working on a plan. So we already have a lot of this on camera, but our surgery table, here, come here, Dr. Gina.
You want to just put this on since you seem to.
Because I'm loud. So this is our current surgery table. It's meets standards. It's a stainless steel food prep table, so we're able to truly sanitize it. But if you take note, Dr. Gina and I are not the same height. So when you're doing surgical procedures, and also the height of the table really depends on your patient. So if you have a big, deep chested dog, I need my table a little bit lower because I'm otherwise reaching into the abdomen. So what we're currently doing is we're turning the table sideways and we're putting these wheels on or off the table. And it's not easy to do. So we had a supporter buy us a surgery table that has an adjustable height, which we're super excited about. And then we're going to be taking this table and putting it into this space so we can have a designated lab countertop. So we can get all of our diagnostic equipment that's squeezed into our office into its own designated lab space. So it's very exciting. Hi, kitties. Keith, I don't know how long this is going to take you.
Not long at all.
Okay. Hi, kitties.
As long as you brought the right bit.
Guess what?
Oh, so
He's got them all.
roll of garbage bags.
Keith, maybe you need to wear the other microphone. Nah, you're good.
Electric surgery table with tilt top, flat.
Almost like a casket, you know?
Yeah, I said the same thing. We could fit some bodies in there. Where are we putting this? Can you tell I'm a wife who helps her husband move stuff a lot? You can't suggest the direction you're going.
Feels like there might be a moment.
Oh, exciting. So we're going to have to cut this, and then it looks like we can just lift it straight out.
Is this one that like raises and
Yeah.
lowers? Oh yeah, that's not that hard.
It's very exciting. Oh, it's heavy. Ready?
Oh, holy moly!
Yay!
Fancy. So
Oh
even if
my
we have a big
goodness.
dog, we can put
Yeah.
that all the way down there.
Just don't cut anything that's not supposed to be cut. In the direction you wish for the table to go.
So directions are plug it in.
Yeah. Oh, it's beautiful.
So that won't hold a horse though.
No.
It might be here.
We can just move the other one like slightly over. So the other thing I love about this is there's so many times where you have to like walk around the table, but this, even with a big dog, this is the appropriate dimension. So it's much longer, but it's also narrower than our other one. What are you going to do with that box, Emily?
I don't know. What am I gonna do with the box? I'm getting baby goats, and I'm gonna use it to fix my little not a shed. What do you call it?
Lean-to.
Yeah, my lean-to in my pasture. I'm gonna use it. I'm gonna fix. There's a couple creaky boards and old ones. I'm gonna fix it so I can bring home my baby goats next weekend.
Sorry for the loud sounds.
We like loud noises.
Oh.
There's a table coming through.
Oh, exciting. Got a laundry basket right behind you.
Hard left, hard right.
Oh, it's beautiful. So we want,
Where do you want the,
Emily needs to go towards, yeah. Perfect.
Do you want the controls on
Oh,
the
careful,
outside?
careful. This is a little fragile.
Do you want, that's the draining part, so does it only tilt one direction or can it tilt both directions?
Oh, it drains.
You might have to do it the other way.
Not sure. I've never actually used drainage. Doc has, when you have a lot of bleeding. I was thinking it would be more handy to have this facing this way unless there's up and down levers on both sides of the
There
table
is.
because, oh, there are? Okay.
There are.
Then we could turn it either direction.
I
And,
think this is gonna be the head,
okay,
I think.
in which case, it needs to go that way. Thank you, Keith.
What's he doing down there anyway?
He is unattaching the power cord so we can plug it in.
Yeah.
Does the power cord come out of one side?
It looks like it's plugged in down here.
Spinning the table around, getting it orientated just right.
Okay.
Tap on it.
Well, I wanted to be gentle, and I also want to see what's going on underneath here. Oh, very exciting. So, see these little guys? This is what we were missing on our other table, too. What is her weight, Caitlin? We are potentially going to spay this kitty. We don't have medical record history on her, so she might have already been spayed, but she doesn't have an abdominal tattoo or a scar that we can see. So we're putting her under anesthesia. Dr. Gina's already done a physical exam and some diagnostics on her. So if she doesn't have strong evidence of already being spayed, we're going to open her abdomen and spay her so she doesn't have kittens. And if we do find strong evidence like a palpable scar or a tattoo that we couldn't see earlier, then we will just recover her and not open her abdomen. Okay, so let's go ahead and put her in the cage facing this way. Yeah.
So how is it having everybody back today?
It's great. It's going to be a really busy day because there's a lot of stuff I couldn't get to without the extra help of our team. But so we're going to be in and out of all sorts of things today.
So I have never been to CE that wasn't vet specific. So it was interesting for me. And I ended up turning my name tag over because I had so many people be like, "You're a vet. Let me ask you about my horse's eyeball." But I had some really good conversations. I did talk to some other shelter veterinarians. I talked to our state diagnostics lab. We sent samples to them all the time. So it was nice to put faces to names there. The most useful lecture for Horse Plus was the state veterinarian, Dr. Beatty, gave a lecture on livestock welfare and the role of the state veterinarian's office. So my takeaway point from that lecture is essentially the state veterinarian can assign investigators, but it's the local DA, local judges, local law enforcement that actually have the power to obtain warrants and take action, either to seize animals or to prosecute animal welfare crimes. So that was interesting. Most of it was small animal specific. Jordan and Emily and I all went. So I learned a lot about small animal shelters. And it seems like a lot of places were more urban specific. There were a lot of talks about like the community, and their communities were much bigger than ours. But we've got some really good ideas to implement, some really good, there's a new journal. There's a journal of animal sheltering that's open access that I wasn't aware that happened. It's only about 2 years old. So read some great papers and have some really good ideas to share with Chandra. Chandra was supposed to go to the conference and I stole her spot. So, and Gatlinburg was beautiful. It was very foggy. I saw a bear in the parking lot right outside our Airbnb. So that was exciting. I did get a video of the bear. I did not touch or rile the bear. I followed all of Gatlinburg's rules. We're going to make sure that she's been spayed, and if she hasn't been spayed, we're going to spay her. A lot of these small animals, like this little kitten only weighs 1.03 pounds, not going to put him under anesthesia today. A lot of these kitties had diarrhea or only had one testicle descended last week, so we can recheck those. But large animals is probably going to be our focus for today. We have a lot of things going on in large animal land.
We're not working.
So we have this blue drape material that is paper, but we reuse it and autoclave it. So this hole was probably made for a much larger animal, so I'm gonna clamp it a little smaller. You do have to be careful with adjusting in surgery because while we don't have most of our patients intubated, if you have an intubated patient and you change your thing, you can really damage the esophagus. So you do have to be careful. This little line right here is called the linea alba, and this is where we're gonna make our incision into the abdomen. And if you don't get right there, it's okay, but you get a lot more bleeding. So, and we usually have some little skin bleeders that are kind of oozy, and that's okay. I also get caffeine hands until about 9 a.m., so that's never helpful. So we make our little tent. I picked the body wall up because the intestines live right underneath. I just moved the table height by accident. We're gonna have to get used to that. This little thing in my hand is called a spay hook, or some people call it a snook hook. And my job is to get reproductive tract without damaging gastrointestinal tract, which can be complicating because they all live right next to each other. We're spaying this kitty. This is the ovary right here. You can see the oviduct, and then you can see these vessels. This is why we tie it off. Like, this is a relatively small cat, 6.8 pounds, and look at those blood vessels. And then we're gonna go down here. This is the uterine body, and you can see the bifurcation right there. And so we're gonna do this on both sides. We're gonna ligate this ovary and then transect, and we're gonna do it on the same side, and then we're gonna tie off the body of the uterus and remove both ovaries and the uterus. So it's an ovary hysterectomy. The ovaries are those hormonal drivers for behavior, and sometimes we can have behavioral problems and or health problems that are associated with the presence of those hormones if we leave those ovaries in place. Called ovarian remnant syndrome in cats, and that can happen when you don't remove the entire ovary completely. So we don't tattoo all animals, but we do tattoo shelter animals here at Horse Plus, and a lot of shelter veterinarians do as well. It's an alternative to ear tipping. If you're doing like a feral cat colony and you want to be able to tell visually if an animal has already been altered, ear tipping is considered an ethical and safe way to do that. We do abdominal tattoos on females that have been spayed here. And I always appreciate that because we get a lot of animals here with no medical history. And you get an animal in, you see that little gray scar on the abdomen, and you're like, okay, somebody has spayed this animal. And that's kind of a universal sign. It doesn't have to be green. There's no like legal requirement. I actually know vets who do cute tattoos sometimes, which feels excessive because a little straight line takes just like 2 seconds. Those knots look great. I'm gonna release that into the body. We're gonna do the same thing on the other side. Double, triple check that we don't have any bleeding from anywhere, and we do not. Everything looks great. This is why it's so wonderful working with Dr. Gina, because I'm like, let's just cut the patient open and do the things. And Dr. Gina catches all of the many things that I miss. I spent the last 3 days sitting down, which is very unusual for me. So my back isn't the happiest with me right now, and it is lovely to be able to adjust this table to however we want. It's gonna save us a ton of time too. It took really kind of 3 people to take the legs on and off because you had to lay it on the floor, and then 2 people had to stabilize the table while the 3rd person tried to wiggle those legs in and out. So very excited about that. Connie, I just got finished doing the first surgery on this incredible table. Look how quiet and easy it is to change heights. It's amazing how quickly your back can be fatigued when you're leaning over, and I don't notice because we get really focused on surgery. So thank you so much. It's beautiful. Kitty's name is Callie. She got spayed today. Dr. Gina and I are so, so grateful for your gift of this amazing table. And not a day goes by that we do small animal surgery that we won't think of and appreciate you. So thank you so, so much. Oh, she's so fluffy and beautiful.
She's gonna go over here to recover. So we're gonna put her in here, make sure she stays nice and warm, and keep her where we can see her. She should be waking up any minute because usually the anesthesia protocol we use lasts about 30 minutes, but Some cats or dogs take longer and some wake right up, so it just depends. But the warmer they are, the faster they wake up.
So this process seems really simple, right? To just use surgical tools, but we scrub them off. So any dried blood or tissue needs to be removed first. This is an ultrasonic cleaner. And we use this stuff that both cleans and lubricates. So I'm gonna do one full pump in there. And then this basically vibrates any dirt or debris off. So I'm gonna do that for about 10 minutes. And then they dry with the lubricant on them. And then we wrap them back up in our surgery packs and we run them through the autoclave. So this is a finished spay pack. This is special tape that changes color. So this is autoclave tape before being run through the autoclave, and this is after. So this is a really easy visual way for us to determine if it's just taped closed, you're like, did someone autoclave that or not? So we know that everything inside this is sterile and can be used. We reuse these tons and tons of times. So you can see the adhesive from previous things on here. And then we can also put size. So this is an appropriate size tools for a medium to large animal. And then we also have other small things that we keep. We keep drapes. This is just some extra gauze. So we use smaller pouches for things that we might possibly need. Here's an extra drape. Say somebody contaminated it or I need to swap my drape out. I've got a sterile one that I can reuse without having to open a whole drape. So we keep those things in there. Our autoclave is in our large animal standing surgery area. So we kind of retrofitted this space. This was supposed to be our break room, I think, in this large animal hospital. And so we've turned this into our small animal surgery room. It works very, very well for what we do. But we do kind of a little bit of walking back and forth to get our stuff ready to go.
So Jordan, how was the Animal Control Caring Conference thing you all went to?
It was really good. Learned a lot of information about a lot of like certification things and stuff that are free online that we can do. Mostly centered on small animal stuff. But yeah, it was really good. There was a lot of like animal capture techniques and stuff that I learned that could be helpful. We got a Y pull to help with like dogs that we don't need to catch pull, but we still need like a barrier to kind of keep them back. So that'll help a lot, especially just around here in the cages. Just with some dogs that we're not sure about, just kind of keeping some distance. But yeah, overall it was really good.
So why are you carrying laundry?
Well, I got back and now I have to resume my responsibilities, and part of that is cleaning the cat's blankets that nobody else seems to want to do. So here we go, laundryman.
That one was a little messy, sticking the washer. No reason to kill our washer or the septic system out here.
Yeah. Gross.
We need a commercial washer. Yeah. But they've been doing good.
He's not eating. He's hanging his head low to the ground and hacking out globs of food. And he's not eating his food either.
Yep, it's in the drawer. It's in that drawer right there. Yeah, what's that? I think that is esophagus. This is Winston. Winston is a 6-year-old. See this right here? Watch. Yeah, I think it's the esophagus. Winston is a 6-year-old, now gelding. He came to us as a stallion. He is microchipped to the jockey club. It looks like he's experiencing choke, so we're gonna grab an NG tube and pass that tube. As you can see, he's in really abysmal body condition score, so we have to be careful with refeeding these horses. Choke is a common occurrence. The esophagus lays on the left side of the neck right here, and you can see he's trying to swallow, and it's blocked right there. Me a little bit. You're a good boy. That was dormosidine. It is a little bit of a sedative, going to provide a little bit of analgesia for him. And we're going to pass a nasogastric tube. We just did this last week. The most common complication for passing an NG tube is epistaxis, which is a nosebleed. It does happen. It doesn't usually happen, but when it happens, it's very remarkable and horses lose a lot of blood. So we always lubricate, but the nasal passages are very, very sensitive. And so we want to be really gentle as we're passing that tube. So we're going to pass this tube up to the pharynx. And then in order for it to pass, the horse has to swallow it. So when we get up here, I'm going to have Emily retroflex his neck a little bit, and I'm going to blow in this tube. That encourages them to swallow. The path of least resistance is into the lungs. So you have to be very, very careful with this procedure. We would never, ever want to pump anything into the lungs, but especially not something that has a surfactant in it, like a oil-based something. So you have to be really, really careful. There's some landmarks. This is pretty typical of a choke. Oh, you're a good boy. Easy. Easy. And Emily, if you're not comfortable, you're okay to just step back. Good boy. Good boy.
From small animal to large animals in 15 minutes.
Okay, hear the coughing? So that was probably in the lungs. You got to remember, horses are obligate nasal breathers, right? So I'm kind of clamping down on his lungs, or on his nostrils. So we got to make sure he can breathe. One more swallow for me, buddy. Did you hear the swallow? And we have no coughing. So that's another indication that we're in the right spot.
There, it's coming.
Holy moly, honey.
So basically we just kind of siphon at this point. So this is your best confirmation that you're in the esophagus. And this is all going to be built up that was proximal to that point of choke. Does that feel better? And at this point, I'm going to have Dr. Gina kind of help me put a little tiny gentle bit of fluid in. I know, Bubs. I'm sorry. Good boy. And you can see that big bulge is gone because that was all the fluid that was built up. Okay. There we go. Okay. And I was able to advance a little bit further. At some point in doing this, you get ingesta in your mouth. It always happens. It grosses people out a lot. I'm just glad they're herbivores because I'm a vegetarian and I don't want anybody's gross meat products. Okay, can I have a couple more pumps? Good catch, Emily.
Want more?
I think we've fully cleared it, but yeah, let's do 2 more pumps and then we'll... So you can see he's not clenching or coughing anymore. I think we've fully alleviated the choke. I know. Oh, sorry, Dr. Gina.
No, you're fine.
You're a good boy.
He's my favorite man, I had to say that after being gone for 2 days.
So the other thing we can do to confirm, I can palpate the esophagus all the way down. I can feel the tube all the way down into the stomach. And I don't feel any, you want to confirm for me, Dr. Gina? I don't feel any. So it was like here.
Yeah, I don't feel any.
And when I blow, I get no resistance. I'm going straight into the stomach, which they don't love, but. Alrighty, and you should be able to see as I pull the tube, you should be able to see it come up the esophagus on this side. Good boy. See it coming up? And you can see the pulsing there is the artery. Okay, so the end of the tube is about right here. You're a good boy. And this is the part where we need to be really slow and gentle. If this tube gets stuck on those nasal, those really, really fragile nasal passages that can cause a nose bleed. Easy. I have to unswallow this. I know. Good boy. Good boy. Did you hear the swallow? Past the pharynx. We are all done. Good boy. You feel better? So this is a great example of why it's awesome that Horse Plus has vets on staff, because often when I see these, the horse has been choking for like a full day, not at the fault of the owner. It's really hard to get an equine vet to show up. This choke probably happened when Winston was fed breakfast, like, I don't know what time it is, but like within the last hour, right? So if you've ever swallowed food and not had it go down all the way, the esophagus is really innervated and can be painful, and like the pressure in there. Do you want to go grab Cherokee? And so alleviating it quickly is the easiest way to prevent further damage. If it stays there too long, you can have necrosis, and then you have scarring of the esophagus, and then you have a stricture, and it can create lifelong problems and a lot of pain for horses. So this is when I love to see chokes. When it just happened before we have food kind of pouring out the nostrils, you would think that horses would be smart enough to go, oh, I can't swallow, maybe I should stop eating, but a lot of them continue eating and continue packing more food into the esophagus. So Winston is gonna be just fine. We're gonna modify his feeding regimen and add some additional moisture, so that slows them down. This poor boy, I mean, look at him. Like, clearly wasn't getting enough calories, and so we do whatever we can to discourage them from bolting food, but he likely is just kind of like inhaling his food. So we're gonna try to slow him down a little bit more. He is gaining weight. I am actually really happy. And he had a really bad case of brain rot that's resolving. He rolled in mud, so this is all just mud, but you can see he had no hair right up here about a month ago, and his hair is healthy and growing in. So overall, his prognosis is excellent. He's a very, very good boy. He's broke to ride. And it's just kind of crazy. He's only 6 years old. So he came into us as a stallion, registered to the jockey club. I think somebody probably looked up his racing career. He can't have done well, or he wouldn't have ended up dumped at a slaughter auction, but we're glad he landed with us, and I'm excited to see who ends up with him. Oh, hi, handsome boy. If you haven't noticed, I have ADD. Dr. Gina and I have Cherokee in today. Cherokee is a lovely, very good boy gelding. He was an owner surrender. He had a history of falling and injuring his pelvis, hind limbs. They saw a bunch of different vets. They weren't able to get definitive diagnoses or a prognosis, and so they kind of ran out of funding available, and they needed a horse that could be ridden, so they surrendered him to Horse Plus. Dr. Gina and I were fortunate enough to have ultrasound training with a boarded radiologist, so we were able to localize the area of lameness, both with our physical exams and lameness exams, but also using our new amazing ultrasound, likely to the sacroiliac joint of the left hip. His lameness is pretty mild and intermittent, but it has persisted over at least 3 months, and including non-steroidal anti-inflammatory drugs, stall rest, kind of all the typical things that you would do for a soft tissue injury. So Dr. Gina doesn't like talking about herself. Dr. Gina is an equine rehabilitation specialist, and she did a lot of amazing research. The product that we're using was developed 15, 20 years ago at least, but it used to only be available as a name brand, and it was cost prohibitive, like $800 per injection, cost prohibitive, very expensive. So now there is an identical product that is a generic available. It's gonna cost us about $80 per injection, which is a lot, but Horse Plus was willing to let us try this with several cases where we think we can get them back to riding soundness, or at least improve their comfort by using this injection. So Dr. Gina is doing a sterile prep, which means we're gonna try to kill as many bacteria on the skin as we possibly can. So we're gonna do alternate scrubs with chlorhexidine and isopropyl alcohol until it's very, very clean. It's a small volume, it's only 4 milliliters that we're gonna infuse into the jugular vein, and the instructions just say, give slowly. So Sometimes they'll say over 30 minutes, and then you have to put in an IV catheter because you don't want to stand there for 30 minutes. This is probably just over the course of a couple minutes. Normally, we don't give slowly at all. We just pull back, get some blood, and we give the full contents. But in this case, we'll just kind of go slowly, let that drug enter her Cherokee system a little bit more gradually. And then he'll need to be in a stall for a few days afterwards, and hopefully we'll see some improvement in his degree of lameness after that. This is something that can be repeated up to 9 times at 1-week intervals, but the clinical trials show a significant improvement in lameness after just 1 or 2 injections in most cases. So we're excited to be able to try it. This horse is so funny because he is the most broke, great ground banners. He's the one we pull when we need the Girl Scouts to be able to canoodle a horse. But when you turn him out, he's not always the nicest to other horses. Can you rest your chin right there? He's a good boy. He's a very good boy.
I can tell you.
Please don't come in right now.
Stay out.
We gotta lock that door. Sorry, we're right in the middle of the infusion. Give us just a minute. Beautiful job, Dr. Gina.
This is maybe, but I prefer.
Come on, handsome boy. He's a very good boy.
Sound very sweet.
Okay. Good boy. All right, you guys, decide what we should do next. Look at this beautiful stall that's available to you. Good boy. Whoop.
So I'm working on some protocols and policies and paperwork type stuff for like when we do small animal intakes and kind of simplifying the process, making it a little more easier for our team when they're doing like large intakes of small animals.
Is that a chicken behind you?
Yes. I have 2 chickens. So I tried not to take it as an insult. Sorry for the noise. John left me and Keith chickens. This is my chicken. It's a granny with a rolling pin. Okay. And this is Keith's chicken, Mr. Fun Guy Hawaiian. And
I think that's what John thought of you.
I think that is. I'm a little... Anyway, those are my
But
chicken.
they make cute noises, right?
They do.
Excellent.
Yeah. So John left me these. If I get stressed, I can squeeze them. So I do have them back here in case I need them.
So I came across Keith out here doing some spot cleaning, and now Jordan's out here doing full cleaning. And this is a much bigger system than the spot cleaning Keith was using, but Jordan's going to be stripping out their stall and getting it all nice new shavings in there. So how was the conference y'all went to?
It was really good, very informative. I think my favorite lectures that we saw, there was one on, I'm trying to think of the word for it, but it was all the meetings that I sat in for the second day of the conference was the like hands-on field type ones, and I really enjoyed the fear-free course that we were taught on. They gave us the website to get fear-free training for shelter animals, and then there was one for the animal control, like how to deal with aggressive dogs and cats, the best tools to use. Learned quite a lot. I didn't take as many notes as Dr. Lydia, but I did take a few notes, and I'm going to try to apply them here to making the time that our small animals spend here better for them in the future, and possibly working on getting the word out on our separate Facebook for small animals, just to get them adopted just as much as our horses.
I
tried and Spartacus slid across the whole pasture.
So the vet team is going to start going down our list of things that we can do procedure-wise. The first thing on our list is doing a dental for Xander. Xander's been here for a little while, but our dental equipment had broke. We just got it back, so we're going to start getting dentals done. Xander, however, is being a little bit naughty this morning, and he wouldn't let me catch him, so I had to get the horse gentlers out here. Yeah, Spartacus, his friend, decided to slide away from me. So I didn't want anyone to get hurt, so I got professionals and not the little vet assistant.
Was that fun, Xander?
You're such a naughty noodle. This is the last thing you need, and then you're ready for adoption, buddy. Let's say hi. Why are you getting that? Good exercise. Good for the big horse part. Okay, we're going to go over the river.
We just got back our dental float from being serviced, and then also we got a new blade. So this is how we do our dentals. People always talk about how awful the sound is. It does sound like an awful sound, but this actually is gentle enough that I could like hold my hand on it and it doesn't cut. So that's important because we're way back in the mouth, often operating by feel. But this part in here, this little head piece, is actually very complicated. It has a bunch of little gears in here. We want it to be gentle enough that if it catches on tissue or is somewhere it shouldn't be, it's not going to hurt, but we need it to be strong enough that it can very effectively grind teeth down. So these, I love this design. Our previous one was purchased almost exactly 2 years ago. So I called the company and I was like, it's kind of rattling and it doesn't feel as effective. And they were like, well, how often do you use it? And I told them how many horses we had come through and they were like, you're probably at the end of your life on that one. So we mailed this part in. They were able to just tighten up and fix this part, but they replaced this blade for us. So first time using this refreshed version with our new dental speculum. So I feel very spoiled right now. You're a very good boy. Do you want to catch Baby? Who? Baby is a chestnut mare who's in the same field as this horse. She also needs a dental. She's very lovely. She loves treats, and you can pop her right there, and then as soon as he's done, we can swap them out. She also needs a dental. So happy, but you're not very sleepy yet. You need to be a little bit more asleep. Well, this thing is still, what's the phrase you use, Dr. Gina?
Weaponizing.
Weaponizing, we're weaponizing the head. However, it feels so much safer than our last one. You gotta open up. A little bit more. There we go, good boy. Good boy. He's got a pretty significant wave, and he's missing his first upper right molar, but it's really nicely granulated in. So he needs a fair amount of work, but I think we can really improve dental health.
Might need more sedation.
Yeah, maybe. I'll start, and if he is like, absolutely not, I'll give him a little bit more. Kate is good. Can you hold this tongue? Thank you very much. All right. I just reduced a tooth by like this much in like, shunk. Everybody okay?
Yeah.
I know. Listen, the anticipation is worse than the actuality. You gotta be able to see though. Alrighty, let me feel everything, make sure we didn't miss anything. I know you're so mad. Oh, that feels so nice. Oh, good boy, perfect. All right, I just gotta rinse, and then we're done. All right, friend, I won't say that you were a perfectly good boy for that, but your behavior was acceptable. I know. Hook wave mouth. So this is the left side of his mouth. Went like this. And the bottom went like this. And what happens when you have this happen is we end up with kind of sharp points. This is obviously exaggerated. We have sharp points, and then this is really sharp and pointy. So I can't magically fill this in, but I can make this nice and flat so that the wear here is even. And as this tooth grows in, we actually can fix this hook wave mouth over time. So this was the left side. On the right side, the upper part was like this. And this is that missing molar. And then what happens on this side is we have this effect happen, because as this tooth is growing, it's not wearing against anything. His gum feels really nice and healthy right here. It's all the way granulated in. And so you end up with, again, sharp points here and no wear here. So we removed this excess wear and then just kind of like gently rounded these off. We don't want this to be like a cave where food can get trapped in. So end result is, as those teeth grow out, we should have improvement over here. When you have a missing tooth, there's always going to be excessive growth right here. So these are the horses that I often tell people, like, recheck him in 6 months, definitely needs a dental once a year. Hi, baby. But overall, his chances of having a very comfortable mouth and maintaining weight are excellent. So I'm really happy about that. He definitely needed a dental, and this equipment is just fantastic. Hi.
This horse is perfect.
Hi.
Look at her ears. Her ears.
Yeah, she's perfect. She's
like a split in her little ear.
her muzzle's a little asymmetrical. Okay, I know your mouth is bad. We're about to see how bad.
Her head.
I'm gonna have you hold her head for me.
You're perfect.
Yeah, she's a good girl. She doesn't like her mouth handled. So, and I actually don't off the top of my head remember how old baby is. Anybody remember?
Old lady. She's older. I can get an age.
That's all right, I'll just look at her teeth.
Yeah. Full carriages and all that stuff, and now we pulled in the horse. Don't play horses, don't play.
Yep. I like the ones with like the wolves, where they're like looking at the cavemen with the fires and they're like, we should go up there. What's the worst that could happen? And the next picture is like a Boston Terrier sitting in a dog bed with its eye, you know, and you're like, yeah. All right, Mama, you gotta open your mouths. There we go, good girl. And we just got our float back from being serviced, and it has a new blade. I mean, that last horse, that was a pretty significant abnormality, and it took us, what, 5 minutes?
Not even, I don't think.
Yeah.
It was crazy.
Hand floats, that would have been like an hour long.
I didn't do the bottoms yet, but I just got the top.
Oh, look at this. Look at this mobility.
Yeah, I was worried about the two.
This one is super mobile right here.
Yeah,
So I'd be
oh, yeah.
careful with that one. I almost could like pull that by hand.
Is that the dead black one that you
Oh, it's
No, it's on the bottom.
it's that sucker's coming out. We should take reds on that. Let's knock the sharp points off.
Okay.
This is Baby. She's a very good girl. She's a little mad at us right now. What I really like about the speculum is she can have a little bit of laxity and movement without it being dangerous. So I think that ability to kind of like move makes them feel less panicky. The other one, you had to crank it until they couldn't move their jaw at all.
Not to get your cheek in there.
It's really great to have Dr. Lydia back, and Dr. Gina got caught up on all the paperwork while Dr. Lydia was gone. She's like, no.
Not completely true.
Okay, untrue. She got a lot of paperwork done. But I think you were dearly missed. And so they're going to take some x-rays. I have not yet seen the new surgery table that was donated by a wonderful lady named Connie. But I'm excited to. But she gets x-rays first because she potentially has a loose tooth in there. So it was really great.
We know it's loose.
No, it's loose.
It's
She
not
had
a
her fingers
potential.
in there.
It is a loose tooth.
And what's really great with this is we're able to stop a dental procedure and take x-rays to figure out like, hey, what does this horse actually need? I worked at a vet clinic for years, and one of my jobs was holding the horse for dentals, and we never had the ability to do x-rays that I can remember. And if we did, it was a very complicated situation, but here we can just do it routinely. Hey, what's going on here? Let's take an x-ray. The digital x-ray machine is amazing.
Kind of see what I was talking about. This is the area where we have a missing tooth, and you can see the tooth next to it's moved over a little bit. So when we go in here, and it's hard to see on an x-ray, we smooth all of the spiky bits off. This space, this tooth was all the way down here on both sides. So that's kind of what we did, and we kind of smoothed this out. It's not a perfect line, but it's enough of an occlusal surface that she should be able to masticate her food much more effectively. This is the lower right first premolar. I need to, really bad at the teeth have numbers. I need to
Anytime Dr. Lydia
numbers.
goes silent and starts looking at us, we're like, ooh.
Yeah.
I'm looking at Dr. Gina because Dr. Gina often is like, it's 204. I will look up what tooth number that is. But anyway, on the bottom right, she has palpable mobility. She doesn't have bleeding gums or evidence of gingival disease. And so often with those teeth, if they're not causing pain or affecting the ability to chew, we kind of wait it out. I might want to pull that tooth before we adopt Baby out, but it's got a really, really shallow root, and that's important because if it's going to be a very, very deep pocket, or if there's a fracture, so I don't see any evidence that the tooth root is fractured, then we can end up with a chunk of tooth left in a jaw that's painful, or we could end up with a really, really deep socket that could get infected. But in her case, it's pretty shallow. I actually think that I could should I just pull it?
You can try.
I think I can pull it.
Before you
Yes, I can go
dive down in there, let's take a look at this surgery table.
Yes.
If we can.
I'm probably going to give her a little bit of...
Da-da-da-da.
Ta-da!
Wow.
Kudos to Dr. Gina. She picked this one out. It was not the cheapest nor the most expensive option, but you ready for this action?
Mm-hmm.
Isn't that beautiful?
It's amazing.
It's very quiet. It also tilts. So if we have a patient that we need to tilt, it's got built-in drainage. It's longer and narrower than our last table, which is a good thing. You want to be able to have, like previously, if we had any surgeries where we had two people scrubbed in, one person is like doing this number
super
to
wide.
reach the patient.
Like this is
And we also had, when we spayed that St. Bernard, what kind of dog was that? I mean, the
so
table
snazzy.
literally, she was like hanging off both ends of the
Yeah.
table. So isn't it lovely?
This is lovely.
Yeah, so this is what Connie donated. And I talked to Connie briefly when I was spaying a cat earlier, but we're super duper grateful. It's incredible. The only thing I have to get used to is I stepped on it by accident twice during surgery. But I think we can just like unplug it if we need to.
Yeah.
So,
So
isn't it
exciting.
gorgeous?
It's beautiful.
Yeah. Caitlin, can you come over here and pull the tongue out that side? I'm trying not to blind anyone. Look, Caitlin, can you see in here? See how you can see between the tooth roots right there?
Ooh.
It's called a furcation. It's one of the visual indicators for removing a tooth.
Can we keep it?
Yeah.
Yeah. Oh, good girl. Oh,
Done.
all right.
There we go.
That was
Got the
easier
full
to pull out
roots.
than my teeth when the doctor pulled out all four of my
Listen,
teeth.
I'm happy to pull your teeth for you, Jason.
Yeah, no. I'm done losing teeth.
Let's get that really well flushed out. She's got some ingested down in there already. I'm sorry, big girl.
This is why you'll see a horse tooth on photos of the day.
It's cute. It's very cute. This is the orientation of the tooth, and the gum line was like right here. So anytime you can see that little space in between, the tooth has to go. You can't leave it in there.
Okay.
So,
Wow.
but it was on its way out. But you can still see like that was a nerve and ligament right there and right there as well. So it was a living tooth, but it was pretty compromised. And I think she'll be more comfortable now that it's out. Yeah, I don't think you can go outside yet. I'm gonna put you in a stall. I don't really need her to be eating or drinking anything while she's this sedated anyway, so.
Really exciting today. We're actually breaking ground on the side shed. There will be a covering for the horses when they load off the trailers. You'll be able to wait under cover, so when it's pouring rain, the horses will be nice, dry, and content. So we've done a lot on the quarantine expansion project, but we haven't been able to really, it's a power pole. It's not very exciting. This is pretty significant. We're breaking ground.
The vets are filming the debriefing video right now. I'm going to try to get real close here so you can hear me. But if you want to watch this, go check out our YouTube channel. Well, you're watching it now, so just go check it out. You can see it. This is the debriefing from all the horses that we rescued.
I hope you're really enjoying these daily Horse Plus Happening episodes. It's been a real challenge with Haley and Macy not here. Our thoughts and prayers go out for them, their loss and their family. But they will be back next week, so we're really, really excited about that. We've all been filming, I think. Lynn's been filming, I've been filming, we've all been filling in on the filming, and I hope you're enjoying it. One thing I did want to address from the video yesterday, I know a lot of folks were like, wow, the loading experience, some people are like, oh, okay, this is fine. Others are like, oh, that was terrible. She wasn't afraid of stepping up into the trailer, and she wasn't shaking, she wasn't sweating, she was calm. Towards the end, she's like, not gonna do it. And that's when we brought the panels in, and ultimately she hopped in. But if at any point that I saw that she was becoming scared of the situation, we would have stopped. But she was like, okay, I really don't want to do this. But with 21 years of rescue and horses I've seen all of my life, 2-horse straight loads are trailers that horses don't like to get into. So I have seen really well-trained horses refuse to go into trailers like that. So we just took our time, and ultimately she was calm and relaxed through that whole process. There's a lot of questions of like, okay, if she was at our shelter for 288 days, why wasn't she more trained? And I can tell you that ever since we've come to Tennessee, our training program has been very difficult. We have to find trainers who are good and gentle with the horses. There's a lot of people that just want to come in and break the horses, and we do not want to have that happen. We've had trainers that will work with the horse a little bit, and then there's so many other horses, they just move on, and these horses end up not getting worked with like they should. And so, we've totally revamped our training program, and we're seeing such amazing success with these Navajo horse gentlers. And this program is something we're piloting. So the 2 native horse gentlers that we have here now, they'll be here till the middle of October, and then they will rotate out. And we have another native horse gentler rotating in, and then he will rotate out, another one will come in, and it will just keep happening. And then ultimately the ones that are here right now, they'll come back. So it's providing jobs to multiple very talented horse men and women on the Navajo Nation. So the training program's being revamped, but for those horses that we rescue, a lot of these younger horses, they will have extended quarantine times. So it's 30 days for sure. If they contract an illness from the slaughter pipeline, they might be in quarantine for 60 to 90 days here, and then go into our adoption program. And how we've looked at it, if we didn't have enough trainers to gentle these horses, is we looked for homes that had trainers, and those are very difficult to find. And now with the Navajo horse gentlers here, we're actually getting these horses gentled and picking up their feet, and they're getting adopted. So just know that just as you're like, well, wait a minute, why aren't they more trained? I'm right there with you of that frustration. And now that we have a totally revamped training program that's so successful, I think we're going to see a lot more horses getting gentled right away, which I would rather see a horse be able to be led to the veterinarians to have a gelding castration done than be in a chute and be scared. So there's just a lot of really positive changes happening, and one of them is that these horses that have been here a very long time are getting training where they can go on and find homes. And we screen every adopter very thoroughly. We make sure that they are the right fit for each horse. A lot of these adopters have trainers they're working with. So these horses are going to go on and have amazing lives. So that's just a little update. I know there's a lot of questions, and I thought, well, I can answer some of them. So earlier today, I was going to put my mural up, and come to find out, it is not a sticker like the other ones, and I really don't want to put glue all over this beautiful, nice painted wall. So I might end up putting it somewhere else, and I don't know. I'm figuring that out. And then I'm working on lobbying. There's just a whole lot of things I'm working on that are not exciting. But I am really excited that the groundbreaking happened up in quarantine for the expansion, and the contractor, I've been speaking with him, and he is lined up, so we should see a lot more progress. So anyways, hope you've enjoyed Horse Plus Happenings, and we'll see what happens tomorrow.
So Shane is working with Sebastian, and I almost went through the whole day. I was so busy filming the vets and everything that I wasn't out here filming the round pen much, but Shane and Amber's over there. They've been working out here all day long. And you saw them catching a horse for Caitlin, but yeah, it is so nice having them here. And I think I'm gonna have to just say it. They picked the best month of the year to come because it's not too cold, it's not too hot, it's pleasant all day. It's just here at the shelter. It was just been a wonderful day, but I've got to get this edited for you guys, so I hope you all have a wonderful evening, and thanks so much for watching.